Colon cancer is the third most commonly diagnosed cancer and the second leading cause of cancer deaths in men and women combined in the U.S. We asked Dr. Mark Minkes at PIH Health about the newest technology for colon cancer surgery.
This is a malignant tumor of the large intestine, which is another term we use for the colon, and it can spread. And it typically begins very small as a polyp, and as the polyp grows, it changes into cancer, and then over time it can spread. Typically it spreads first into the lymph nodes, and then it spreads throughout the body. The treatment for colon cancer is to remove that cancer and remove a section of the colon where that cancer begins. That used to be done with a major incision in the abdomen, a long cut. Now we are able to do this colon removal or resection with a laparoscopy technology. It's a camera technology with small incisions, some no more than an inch in size. So it creates a very excellent visual field, much like you see on a television, where I can see through my camera 3 dimensions, and that's called 3D, three-dimensional monitoring and technology. So we have one port, we call it a site, where we have the camera operating, and we put several other ports in, small incisions, and we utilize specialized instruments guided by our 3-dimensional vision to remove a section of the colon and then to hook it back together so that our patients can have normal function, bowel function. This technology gives us better visualization, and when we're working in the area of minimally invasive surgery, vision is very important, and what it's doing is duplicating the same vision that we've been able to achieve with open surgery. Benefits to the patient are safer surgery, less injury to neighboring structures, neighboring organs, neighboring tissue, because we're able to have better visualization of the area that we need to operate on or remove. There are other disease processes where we can use 3-dimensional laparoscopy. It can be used for a less complicated and much more common surgery, what we call removal of the gallbladder or cholecystectomy. We've removed spleens, which is an organ that sits up on the left side of the body and sometimes needs to be removed with 3-dimensional technology. We've removed portions of stomachs with this technology, portions of small intestine. So it can be applied to a wide variety of intra-abdominal surgery. It can also be applied in the chest. We're doing, it's called thoracoscopy, 3-dimensional thoracoscopic surgery as well. So again, the big advantage is that we can see as if we're not using a small camera. It's not really futuristic, it's here, and it's a better dimension to work in when we're able to see in 3 dimensions. So overall, I think there will be a lot of these so-called towers out there in other hospitals.